My name's Anna Winfield. I'm an associate specialist at LTHT, and I also work leading some quality improvement projects in the Trust. I've been involved in the HEAP project for about the last year, and I've thoroughly enjoyed all my involvement with the innovation pop-up. So being involved in the HEAP project has really helped our project develop, and it's helped us think a much more broader when we're thinking about challenges we're facing. In the past, we used to be sort of confined by what we thought was or wasn't possible, but actually being able to bring in innovation, new ideas, the advice of Chris and colleagues from the Innovation Pop-Up has made us think much more innovatively about other aspects that could be really important for our project. And particularly when we spoke to the team in Barcelona, it made us realise that the problem we're facing with discharge is absolutely not just a UK thing, it's a national, international and national problem. So all the more opportunity to involve innovation and as much as we can to try and tackle this issue. I've learned quite a few new skills being part of the HEAP programme. The one that springs to mind most initially is the skill in developing a pitch. So this was something that I'd never, ever done before. I cannot wait to go on the exchange visit. It sounds like a really exciting programme lined up for us to look at all and connect with all the people in Barcelona who are involved in healthcare innovation, to visit some of the businesses involved and the healthcare system over there, to look at how we can take our project further, develop it and bring back as many new things and new innovations that we possibly can to Leeds. That's what I'm hoping to achieve, and I'm really look forward to the opportunity. I would definitely recommend the HEAP programme. I think it's during the pandemic, it's been really challenging working clinically and in non-clinical areas as well. I'm sure it's been, difficult to focus on positive things at times. So this has been something that's kept me, Viv and Emily going during the pandemic, and it's made us think, well, actually, no, despite the pandemic, what can we do? How can we challenge ourselves to think differently? What innovations can help us? And what's next for the Discharge Collaborative to develop it further? So it's been a really positive experience, and I definitely recommend it.
Hello, my name's Vivian Lewis. I'm Head of Nursing at Chapel Allerton CSU and co-chair of the Discharge Collaborative with Dr. Anna Winfield. We got involved with HEAP from the collaborative. So our Discharge Collaborative, as the name says, is looking at how we can improve discharge using a collaborative and quality improvement approach across the whole organisation. And we started quite a long time ago now with a small number of pilot wards, trialling interventions and innovations that they come up with themselves. And we use data to look at and track our progress and their progress. It's very difficult when you're working across multiple ward areas to always know which bed is available and when. So when we got involved in the HEAP project and then subsequently Dr. McKee invited us to the pop-up, we were able to have a really good conversation at that point about the potential of electronic systems for live bed state tracking. So that's where we are at the moment. That's one of the exciting parts of the project, is to be able to get something from nothing to something very manual and very sort of not paper-based, but board-based, that you write on with a felt tip pen, to looking at a digital or electronic solution. And that's where we are currently.
Hello, my name is Emily and I'm one of the Trust Grade Registrars in Elderly Medicine working at St James's Hospital. Our project has been expanded over the last 6 months through our involvement in the HEAP and Research and Innovation team. We're now looking at expanding across the entire Trust from our 25 pilot wards. So we've got a lot of work to do working with lots of different ward teams to sort of educate them and train them on what we've been doing so far and how we're going to take this forwards. Our work through the research and innovation team at LTHT and the HEAT programme have allowed us to think about digitising solutions. We are employing the brains of the research and innovation team really to take us away from our clinical problems, and they present us with solutions digitally. From the start of our application to the HEAT project, we have felt supported and like a valued member of the research and innovation team. They have supported us throughout the process and worked as a sounding board, listening to our ideas, even when we felt like some of them were silly, and helping us to develop our application, our pitch and our business model. The research and innovation team have access to a wide network of collaborators and innovators, and this allows us to come to them with our clinical problems and they present us with digital solutions. Being a member of the Innovation Pop-Up allows us continued access to a space away from our clinical work and an ability to reflect with the innovation and research teams to come up with continued solutions to our problems.